Fertile Mind is a podcast brought to you by Virtus Health, who have over more than 40 fertility clinics globally in Australia, including Melbourne IVF, IVF Australia, Queensland Fertility Group, and TAS IVF. Our goal is to demystify fertility and assist you getting pregnant faster. Over the coming episodes, we'll be sharing helpful tips and evidence-based advice around the key fertility topics. So be sure to browse our episodes and subscribe so you don't miss a thing. You can also watch videos of these recordings on our Fertile Minds YouTube channel. Let's dive into today's episode. Welcome to Fertile Minds. I'm Dr. Kokum Jayasinghe, a fertility specialist with Melbourne IVF with over a decade of experience in the field, helping women and couples to grow their families. Today, I'm joined by Dr. Yousif. Welcome, Yousif.
Thanks, Kokum. My name is Yousif Alyousif. I'm also another fertility specialist with the Melbourne IVF. And I did most of my training back in New Zealand, and I've recently joined Melbourne IVF when I moved to Melbourne.
Yousif, I think there's some news to celebrate. Is there anything you want to share with us today?
Yes, absolutely. Thanks, Kokum. So, as you know, as part of my journey to come to Melbourne was to do this extra training in fertility. It's a certificate called Certificate of Reproductive Endocrinology and Infertility, CREI, which is the highest certificate you can get across Australia and New Zealand for fertility training. And I'm pleased to say I've just passed my written exam, so I'm that step closer to finishing the certificate.
Congratulations.
Thank you. So, Kokum, as you know, today we will be discussing male infertility, whether that's different treatment options, whether investigations, or how we can optimize male health to increase the chance of pregnancy. So, Kokum, we'll kick off with the Fertile Fast Five. We'll take turns asking each other questions so our listeners can get to know us a bit better. So, Kokum, what sparked your interest in fertility?
It was actually my own experience in the fertility that's sparked the interest. I faced infertility myself, and I could say that was one of the darkest period of my life. And as they say, every cloud has a silver lining, and this was mine. So my kids are now 17 and 14 years old, and it is fair to say my experience has made me the doctor who I am today, and it could be a byproduct of the journey I went through that I ended up as a fertility specialist. So I feel like I get them, I understand them at a deeper level, and I see them at a more depth than average.
So you can connect with your patients at a personal level.
Absolutely.
Yeah.
Yousif, what is your most memorable experience in fertility?
That's an interesting question. There are a few moments, but I'll go back to where it all started. And many years ago now, when I was a medical student, I was interested in the fertility field, but really you don't grasp what the field involves. So I decided to go and spend time at a fertility clinic as a medical student. And it was just so fascinating to be part of the journey from the start. I saw when the eggs were collected, then I followed through in the lab and saw when the eggs fertilized. And a few days later, I looked under the microscope and I saw the embryo. And then we went through an embryo transfer. Luckily, 6 weeks later, when they came back for a pregnancy test or pregnancy ultrasound scan, that was positive and I could see a heartbeat. And that was just so fascinating and just cemented the idea that this is really what I want to do.
Fantastic.
So it's your turn, Kokum. What is the most important advice you would give to your patients or couple who are attempting to conceive?
I think the most crucial and simple advice I want to pass on is to seek help early. So once you get assessed, properly investigate and find out what's going on, you'll be given options which you can assess and see where you sit comfortable. By keeping things too late, you may miss out on certain options. And in fertility, what we are fighting with the most is the age, which is the most significant biological factor that we can't fight with. So simple advice, go seek help early.
Fantastic.
Next turn is yours, Yousif. What are you excited about the future in fertility?
I think the future of fertility is quite bright. As a field, relative to other medical fields, we're still quite young. There's a lot that we don't know. And it is fascinating to see all the research happening in our lab. And recently, I see collaboration between our scientists with engineers and also software engineers integrating AI into what we do in the lab. And One example recently is they came up with a 3D printed dish. And that 3D printed dish is to help reduce the pressure on the egg when we inject it with a sperm to minimize any damage. And using AI to try and find sperm in a testicular biopsy. And that can cut the time significantly, and that frees up our embryologists to go and do other things that they are excellent at doing.
So watch this space, isn't it?
Absolutely. There is a lot happening. So, Kokum, last question. What is your favorite part about being a fertility specialist?
I have to say the favorite part is to show them that fetal heartbeat and see that beaming smile on their face. And next to that comes the first visit where I actually get to know the patients. So my room is a safe place for them to express whatever the emotions they want. And they're safe to come and cry. They're safe to come and tell me anything they want. So I want to spend time with them at that first visit, actually understanding what's going on their lives, what they have done so far, and also what their family goal, what their family dream is. So from then onwards, I can be part of their journey and be more than just a doctor, be their shoulder to cry on, be their coach, be their whatever they want me to be. So it's actually a journey we take together. And I enjoy that part the most.
Oh, that's amazing, Kokum. And I have to say, I have actually heard that feedback from your patients, and they love the care that you provide.
Thank you, Yousif.
So, what's in the news? Each episode will break down the latest headlines and what's the latest news in fertility. Kokum, you might have read recently or come across these articles where there's a suggestion, there's a trend of reducing sperm count globally. And some of the articles will suggest if we look back 50 years or longer, there is a drop in the concentration of sperm, the percentage of fast-moving sperm, and there's various reasons why that might be the case. So what could be causing this, and how can we reverse it?
It is certainly alarming to hear these figures and news, Yousif. The good news is there could be a lot of things we could do to try and reverse this and preserve the sperm quality. So common contributing factors for these changes could be poor lifestyle that men choose these days. For example, highly processed food, high in saturated fat and sugar, smoking and heavy alcohol consumption, and drugs like marijuana or cocaine. Sedentary lifestyle that leads to high BMI, and commonly discovered illnesses like diabetes, high blood pressure. These could be reasons for poor sperm quality. On top of that, environmental factors like high air pollution and endocrine disrupting chemicals that we find in pesticides and above average plastic use. So, how could we reverse these things? Obviously, try to live a healthy lifestyle by avoiding things we just mentioned, and being the best version of yourself, paying a bit more attention to your sleep, hydration. These are very easily overlooked. And things like relaxation and stress management. So these are complex topics, of course, but at least being aware, these are things that could lead to poor sperm quality and making an effort on them.
Overall, there's a number of reasons why fertility might be affected. So as you say, it's important to be the healthiest version of yourself you can be and avoid all these exposures that could have a negative impact.
Absolutely. Yousif, today's topic is male infertility. We can't finish this conversation without me mentioning about my most memorable case on male infertility. So you have to hear this.
Okay.
So this is a couple I saw a couple of years ago, came in with many years of primary infertility or struggling to fall pregnant. And with routine investigations, we discovered male partner has no sperm in the ejaculate, what we call azoospermia. So things led on, and he ended up with the open testicular biopsy hunting for sperm. And we managed to find 2 sperm.
2 sperm.
We injected them into the female partner's eggs, and 1 got fertilized. And a few weeks later, we had a positive pregnancy test, and the baby would be now a toddler. So this is the most memorable case I have. And I think this highlights the point, you only need 1 good egg or 1 good sperm. It can take it all the way.
Mm.
And that also highlight the point that the magic that happens in the lab and all this, the lab staff and the whole team involved in this helping this couple. Most importantly, at the end of the day, when you see their beaming smiles and their hearts pouring out with gratitude, it reminds us all what we do, why we do what we do.
That's an amazing story. That's absolutely right. And as you say, you only need one good egg and one good sperm.
And a team to help you.
Absolutely.
So, what causes male infertility? There are a number of factors. But when we look at a sperm sample, it could be sometimes absolute no sperm in the sample, what we call azoospermia, or there can be reduced concentration, what we call oligospermia, and anywhere in between with abnormal sperm shapes to poor motility and high DNA fragmentations. So sometimes we find underlying causes for this. There's like a production problem, or there's an obstruction of the ducts that is delivering sperm from testes to outside. Or there can be overall generalized medical conditions that is contributing, like diabetes. And poor lifestyle factors and environmental factors that can also contribute to poor sperm quality.
I see. So, as you know, Kokum, I'm a very simple-minded person. I think of this as you correctly said, it could be a production problem in the factory, which is the testes, or it could be a problem within the assembly line and distribution line, and that's the conduit or the vase that get the sperm to the outside world. And hence, I guess some of our listeners might hear about this obstructive versus non-obstructive
Absolutely.
azoospermia.
And another point I want to highlight, Yousif, the method of ICSI. ICSI stands for intracytoplasmic sperm injection, which is the method that revolutionized male infertility and the treatment available. So IVF science is about 45 years old now, and it is in the early 90s that we discovered ICSI. ICSI means as long as we find some sperm, as the case I highlighted and explained to you, as long as we find some sperm, we can pick a sperm, a moving, normal-looking, alive sperm, and inject that into the female egg. We can help these couples to have their own biological children. Until ICSI was discovered, which completely revolutionized male treatment for infertility, these men could not have children, biological children of their own. So this was one of the marvels in our field.
Absolutely. And it's amazing technology. And just because there is no sperm in the ejaculate, if someone is diagnosed with azoospermia, it doesn't mean they have to give up. There is still hope.
Absolutely, yeah. And the technology and the treatment options are getting better and better. As you said, watch this space.
So, Kokum, you mentioned lifestyle factors. And as we know, there are a number of factors that can have an impact. One of the common ones, and there's stronger association, is smoking. So definitely when I see someone who has abnormal sperm count and they are smokers, that's one of the first things I will target. And there are other things like obesity, for example, that can have a negative impact. And sometimes it's difficult to grasp why obesity might have an impact. And there's a number of reasons for this. And one of them, it can actually have an impact on your hormonal balance, but also it can increase the temperature in the scrotum. And heat is the enemy of sperm. So any other reason that will increase heat exposure to the testes, whether that's because of your job, whether you're someone who wears very tight-fitting clothes in your job, like a firefighter, for example, or that might increase the temperature in the testes, that can also affect sperm production. There's a reason why the scrotum is outside the body. The testes need to be cool, need to be, again, my analogy with the factory workers need to be cool to work better, and it needs to be roughly about 2 degrees below your body temperature. So avoid excessive exposure to heat, whether that's frequent trips to the sauna, or whether that's a very hot tub frequently. Once off every now and then is not going to have an impact. Hot showers are absolutely fine. It's just the constant exposure to excessive heat. And there's other things in our environment, whether that's medications that you take that can have an impact, or also, like you said, plastics. So if you're someone who packs their lunch to go to work and you package it in a plastic container, for example, one of the bad things you can do is chuck that in the microwave and heat your food in the microwave, because that plastic can leach into your food, and it is what we call an endocrine disruptor. And so what's an endocrine disruptor? It's something that will mimic your hormones and again can affect the balance of hormones in your body. And you can find them in many places. And so it's hard to avoid them completely, but the idea is to try and minimize your exposure as much as you can. And this could include things at home or through your job as well, like herbicides and pesticides, or exposure to other chemicals or heavy metals. And because it's all around us, it's hard to avoid it completely, but the idea is to minimize exposure as much as you can.
Conceiving a baby is affected by many factors, including healthy sperm. After the female age, sperm or male factor is the second biggest reason for delay in couples falling pregnant.
That's absolutely right. I know it is this myth or misconception out there that if there's a fertility problem, it's usually a woman's problem. But in half of the cases, there is a male factor contribution as well. And in a third, or sometimes I just say the third, a third is a female factor, a third is a male factor, and a third is kind of combined. So definitely is a couple problem. And it, as you know, it takes two to tango.
Absolutely. So what can we do to improve sperm quality? I think, Yousif, we are coming back to the same points over and over. So to keep it simply, I think addressing lifestyle, diet, exercise is the key here. So if you look after yourself and be in the best health possible, you're halfway there. So that will reflect, your health will reflect on your sperm, and sperm will be the best sperm they can. So emphasizing again, smoking has no place here. Definitely that's a toxin that will affect sperm. Alcohol in moderation or minimize. A glass here or there is not going to be a big problem, but if you are having far too many every night, certainly will have a say in your sperm quality. No safe place for drugs, and exercise to keep your body healthy even though you may not be actively trying to lose any weight. And stay away from the environmental toxins as much as you can, even though we can't completely minimize it. These things are important. Then other things you can do, probably can take some sperm-friendly micronutrients that are packed in vitamins. And there's no harm doing these things. Also, what we have seen in studies is frequent ejaculation. So it is a bit like breast milk. It is a production and demand. So as you ejaculate, there's more and more sperm frequently produced, and that also usually increases sperm quality.
Absolutely. I think you're right. There's no magic bullets. It's important to be the healthiest version of yourself that you can be and avoid all these potentially negative exposures that you might have, whether that's through medications, whether that's through your lifestyle. As you said, smoking definitely a no-no. So it's good to have that holistic approach. See if there's something that is reversible before we jump into a treatment. And I think sometimes we focus more on just let's treat what's the treatment option that we can offer, but we need to take a step backwards and say, how can we optimize the health of the sperm that we have so we can then optimize the outcomes for any treatment we can offer.
Absolutely. And taking it another step further, even if a couple needed IVF and ICSI, the sperm you give to the lab is what comes back to you as an embryo. So even if we needed sperm to do IVF, the better quality sperm you give, higher your chances of achieving a pregnancy.
Absolutely. So as you know, Kokum, there's a number of treatments that we can offer to treat male infertility. And in some way, it depends on the degree of abnormal sperm that we have. If there is mild sperm problems, sometimes we can offer a simple treatment. For example, something called intrauterine insemination, sometimes called artificial insemination, but there's nothing artificial about it. We're still using your sperm. But what we can do is we can concentrate all the good swimmers, and then the sample will have concentrated, fast-moving sperm, and then we can give them a head start because we place the sperm, the concentrated sperm, inside the uterus at the right time of the cycle, just around the time of ovulation. Yeah.
And Yousif, I simply explain this to patients as you are putting your best players closest to the goal. So it is easy for them to go and kick the goal. They get it.
Absolutely. Men need some direction, even though sometimes we don't ask for directions. When there is more severe male factor issue, like your case that only had 2 sperm that was surgically found, that is not possible. We can't do IUI. The chance of success is is very low. So we move to more advanced technique. And the advanced technique that you mentioned before is ICSI, or what we call intracytoplasmic sperm injection. It's an advanced technique that's used in the lab. The first part is we need to get sperm from somewhere, whether that's from the ejaculate, if there is sperm in the ejaculate. If there is no sperm, we might need to do either minor surgery, such as using a fine needle, just like having a blood test, under local anesthetic, and we take a sample from the testes or from the epididymis, which is the storage area just above the testes. Um, if that's not possible, for example, in severe cases of non-obstructive azoospermia, especially if they have some genetic issues, we need to use a surgical microscope and we go hunting. And the testes, as we said before, is like a factory and it's filled with all these tubes that can look like spaghetti. And sometimes you have a small area that might be hiding and producing sperm, while the rest of the testes have no sperm production. So if I go and do a random biopsy with a needle, I don't know which area I'm biopsying. Hence, the advanced surgical technique where we do microscopic testicular sperm extraction, or microtesy, where a surgeon with an expertise will use a surgical microscope. It is done under general anesthetic. We look at the tubes or the spaghetti. You'll find one part that looks fatter than the rest, and that's normally the part that might produce sperm. So we go and sample that part only, and that increases the chance of us finding sperm in someone who has no sperm in the ejaculate. So that's the first part. We need to get the sperm from somewhere. And then once we have sperm, if we have sufficient quantity, we might be able to do conventional IVF, which is where you'll need hundreds of thousands of sperms, incubate them with the egg overnight, and let nature take its course. But if we have fewer sperm, like your case with two sperm found, we need to be a bit more selective. So we inject one sperm directly inside the egg, which is called ICSI, and that has been revolutionary in treating male factor infertility.
So I have a couple of points to add there, Yousif. So which method would you be using, for example, when a patient comes with the previous vasectomy?
Yeah, so that's actually a good point, because as we said last time, you have the factory, the testes, and then you have the vas, which is like the conduit that gets sperm to the outside world. And vasectomy is you transecting the vas, which is the tube. So you are producing sperm. It's just trapped. It can't get to the outside world. And usually you can simply get sperm with a fine needle under local anesthetic. So the procedure is actually quite minor, just like having a blood test. Some of the boys might be worried about having this procedure done, but I can reassure them it's quite minor.
And the other thing I hear in the lab and from the scientists, the sperm selection methods are getting polished every day, and there's more and more new technology coming, and it is amazing to see what's happening in the lab.
Absolutely.
One other point I want to add, Yousif, I have heard you explaining DNA fragmentation to medical students, and it is brilliant. So give us a little bit background about what DNA fragmentation and what is it doing to fertility.
Sure. So our listeners might hear about DNA fragmentation. It's quite topical these days. And what is DNA? What is our karyotype? So karyotype, we are human, we have 46 chromosomes, and as a female you'll have an X, and a male you have X and a Y. That's what makes us a male and a female. So what is a chromosome? It's our instruction manual, essentially, that what carries our DNA. And DNA is like a code language, and if we have breakage within the DNA, it's just like having tears within your instruction manuals. Sometimes you don't have all the instructions that you need, but the reality is there's a lot of data, so to speak, in our DNA. Not all of it is useful. We don't even know most of what the data actually means. So the part of our DNA that's actually useful is a small percentage of our genetic code, so to speak. If the breakage or the DNA fragmentation, hence the fragmentation, the breakage, or the tears within your instruction manual is in an area that is not needed, you might not see that reflected in the quality of the sperm or the quality of the embryo that you produce. But if you have high DNA fragmentation, then now we have a lot of tears within our instruction manuals, we're more likely to miss an area that is actually important. How we might see that in real life? We might not see good fertilization in the lab. The fertilized embryos might be of lower quality, or when we put the embryos back, there's higher chance they might not attach. So recurrent implantation failure, or when they attach, there's higher chance of miscarriages as well, or losing that pregnancy. So it's not a refined technique yet. There's a different test that we use, and different lab will use different method. So when you see a number from one lab, that doesn't necessarily mean it's the same test in another lab. But there are ways that we can do to improve DNA fragmentation, which is things that you've mentioned.
I think it is fair to say it is not one of the first line tests we do, but when we are puzzled with what's happening, this is something we will be go hunting for.
Absolutely.
And we are seeing more and more DNA fragmentation high cases these days. And again, I think we are going back to our basics again, lifestyle. Environmental exposures, and these things can contribute to high DNA fragmentation.
That's always the first thing that we look at. Is there a reversible cause? And that could be, as you say, lifestyle, as simple as smoking, someone who is a smoker. But there are also other health conditions that can contribute, and we shouldn't forget. Sometimes there's a condition called varicocele, which is like dilated veins within the scrotum. And it has have an impact for a number of reasons. One of them is because the blood flow is not happening as fast, so it's trapping heat. And again, we go back to that excessive heat exposure, and that can give you poorer quality sperm, but also increases your DNA fragmentation. If we treat the varicoceles, you might not need other fertility treatment, but anything that we do now is not going to be reflected in your sperm sample for at least 2.5 to 3 months.
I think that's a very important point, and we should highlight that all these changes that we do, getting to the best version of our health, is going to take some time to reflect on the gametes or the sperm sample. I think we overall say 72 days or 3 months, because if you stop smoking today, certainly every cigarette you don't smoke is doing you good, but that is not going to reflect on your semen sample tomorrow. So that is going to be a long-term effect, and these lifestyle changes are there to stay.
Absolutely. So for the long term, and especially if you've been a smoker for 20 years, if I stop now, I expect that will take longer for my body to recover than someone who was smoking for a year or two, for example.
Absolutely.
Yeah.
When should you seek help? Overall, it is fair to say female age is the number one factor. So if you are under 35 and you are healthy, there's no red flags, it is fair to try 12 months before you come see a specialist. Pregnancy rates per month is 20%. So if you're not pregnant straight away, yes, it hurts, but give it some time. If the female is over 35, we would like to see you after 6 months of trying, mainly because fertility decline after 35, and you may want to have that dream family you want. So we want to allow time for that dream to come to reality. Having said that, if there are red flags in the history, for example, if the female is having irregular cycles or no periods at all, it is a bit silly waiting 12 months to see a doctor. So if there are concerns in the background, please come and see us anytime. There could be endometriosis, there could be recurrent surgery you have had, whatever the concern, it would be good to see us early. From the male history side, if there are history of sexually transmitted diseases, if there a history of undescended testes and needing surgical correction, or any hernia repairs in the groin or varicocele repair, previous exposure to chemotherapy, anything that you consider as this is significant, there's no need to wait. It is a good idea to come and see a specialist early.
You will probably agree there's no fast and hard rule. If you think there is a problem, come and seek help early. We're more than happy just to have a conversation. It doesn't necessarily mean we will push you towards having to do treatment. It's important for you to get investigation, get as much information as you can, so you can make an informed choice going forward.
And when you come to see us, it is important that we investigate you as a couple. It's not fair to ignore one person and just focus on the other. So we would investigate you as a couple. And given our topic is male infertility, what we would be doing on the male partner is taking a thorough history. We look for red flags and ask you a question to see, is there any concerns here? And an examination. Then the first and the most important thing from the male side is doing a semen analysis. That is going to tell us a lot about what's happening there. If the sperm test is normal, of course, we would be reassuring you to say it looks normal. If it is not, we would be doing further necessary investigation starting from a repeat, because it's unlike in females, we are born with our eggs and the boys produce a new batch of sperm every 3 months. So one test doesn't tell the whole story. So we would be starting with the repeat test and adding other tests as necessary.
Absolutely. And I think it's important to know that if the male has been unwell for any reason, that can be reflected in their sperm count and might be abnormal. It doesn't necessarily mean that's their usual sperm parameters. Hence why we repeat it after they're well.
Absolutely. And Yousif, we saw that a lot during COVID time.
Yeah.
When you were unwell with fever and really sick, the sperm test was telling the same story. And most of these people recovered with time.
Absolutely. And I think this, with the sperm analysis, is more than just looking at the sperm count. We look at the count, we look at the movement, and we also look at the shape of the sperm or morphology. But there's also other information that sometimes they might not pay attention to, but we do, like the volume, like the pH, how acidic the sample is, how healthy the sperm looks, what we call the vitality. All of these things give us different information that might help us to what can we do next? Does this person need further investigation? Or what do we think is going on there?
Absolutely. What a great discussion we are having, Yousif. We should be doing this more frequently.
Absolutely.
Let's move on to the next segment, IVF Mythbusters.
Absolutely. Thanks, Kokum. With so much information out there, sometimes it's difficult to separate fact from fiction. And that's what we're here for. We're here to bust the myths and give you the facts. So one of the myths out there for male infertility, if a man has had a child before, that means he has no male fertility problem. But as we both know, things can change over time for a number of reasons.
Absolutely.
Whether that's there's changes to his health that might affect sperm production, whether him contracting an infection, for example, that causes an obstruction. And sometimes that is not frequently volunteered by some men, is starting a new medication. Some of these medication can be non-prescription meds, like steroids, which you might get in the gym. And you might think of steroids or testosterone, I'm getting extra testosterone that will help me produce more sperm. And in reality, it does the exact opposite.
Yeah.
It tells your body, I have enough testosterone. So your brain thinks, I don't need to tell the testes to produce testosterone. And the testes have two jobs, mainly. One of them is to produce testosterone hormone, which is the male hormone or androgens. And the other job is to produce sperm. If the signal from the brain says you don't need to produce more testosterone because it senses you have a lot because you're taking testosterone, your sperm count can also go down to 0. So again, just because you've had a child before, it doesn't necessarily mean you don't have a male factor problem.
And Yousif, this was exactly the case I saw just before coming here. A couple who easily conceived their first child and now struggling to have the second. And we did the relevant investigations, and this morning before driving here I saw the couple, and it was severe male factor infertility with a very low sperm count. So obviously they're puzzled as to why. So we are investigating to see what is causing it. The good news is we can certainly help them to have another child. And what I actually do in this situation, or we as specialists do, is get him to freeze some sperm and keep it as a backup, because we might get away this time for the second child. What if they want to have more, and when they come back there's absolutely none? So we are always thinking ahead, and their family goal, their dream is my dream, and I want to keep that a reality.
Absolutely. And I think it's for us as fertility specialists, that could be the first window into a male factor health problem, not male factor infertility.
Absolutely.
This could be a reflection there is a health problem going on there. In rare cases, that could even be the first presentation of testicular cancer, for example.
Yeah.
But not to scare everyone out there, there's many men who will have no sperm, and it's not because of cancer, but for us as a trigger to start the investigation to find the one in a few hundred that might have it.
Yeah. It's key that we emphasize we want to help you to have a baby, and we want to make sure you're healthy. So we are investigating to make sure your health is not affected, and we are not passing on any genetically possible conditions to your children.
Absolutely. We want you to be there for the baby.
Absolutely.
Yeah. So for our listeners, thank you for listening today. We hope you found the information helpful while you embark on your fertility journey, or just while you're trying to find more information about fertility. So Kokum, if people want to connect with you, how can they find you?
They can find me on Instagram at Dr. Kokum, or visit my website drkokum.com.au.
And for me, you can find me on Instagram as well as dryousif.alyousif or my website dralyousif.com.au. And to our listeners, if they want to learn more about myself or Kokum, they can visit our Melbourne IVF website mivf.com.au.
For all things fertility, subscribe now on Apple Podcast, Spotify or YouTube. Connect with us on Instagram at fertileminds_official to join the conversation. Do you have any fertility questions? Send us or message us on Instagram to our fertility specialist who will answer your questions on the next episode.